Addressing teenage pregnancies require more than extending contraceptive services to the grassroots. In Toro region, communities have embraced contraception, yet teenage pregnancies persist due to limited awareness and access to information. Testimonies from Kabatunda Town Council, Kasese District, reveal the harsh realities of teenagers caught in unintended pregnancies.
He had advised me to discontinue family planning so that I can conceive for him. By then, I was only 15 years, not ready to produce.
A case in point is now a senior 2 student who impregnated a fellow student while still in primary 7. Though families provided support, the emotional trauma remains evident.
I couldn't endure what I went through. There were many challenges.
Similarly, 19-year-old Martin Mumbere recounts a comparable experience, highlighting how teenage pregnancies affect both boys and girls.
One, in terms of support, you find now that one child is now in Nyangabo being supported by now the parents of his mother, and one is at home. I'm the one taking care of him.
For many young girls, poverty and peer pressure are the leading factors contributing to early pregnancies.
I had no one to provide for me things like pads, knickers, sandals, and here he was ready to provide.
Reflecting on their experiences, teenagers who navigated these challenges emphasize a simple lesson. It is not good to enjoy for a short period and suffer for a long period. Abstain or use protection.
My teenagers try to persevere and wait for the right time to reach.
Let the youth say it from us that they should wait for the right time.
On Friday, the world commemorated this year's Contraceptives Day with renewed calls for government and stakeholders to raise awareness, especially among teenagers.
Bold donors and development partners to invest in a girl child the same way we invest in their education, to invest in their choice for contraception uptake.
The head of grants, Mary Stops Uganda, highlighted that approaches used in fighting HIV/AIDS can serve as a model for addressing teenage pregnancies.
Should you find yourself in a position where you're already either sexually active, etc., what do you need to do to safeguard yourself? And I think these are conversations we need to boldly start having at national level, at family level, and etc., to ensure that we safeguard these children.
Currently, Mary Stops Uganda, a non-government organization providing healthcare services including contraception and general health care, is bridging the gap by building capacity among health workers in various communities.
So today, we see a lot of these challenges and because they reduce these challenges that were because at one time when adolescent pregnancies we were at 26, but now we see we are declining. We are at around 16%.
Recent funding cuts to reproductive health services by USAID have negatively impacted the provision of vital services, leading to frequent stockouts.
Yeah, we have been making our bimaterial orders to the NMS, but still they don't supply us as how we have ordered. So we have been having on and off stockouts. Maybe they are also reducing, affecting our numbers.
This year's World Contraceptives Day ran under the theme Breaking Barriers, Building Bridges, Contraceptive Access for All. Suzanne Nabugude, BC News.